This is Damian McNamara at the American Academy of Family Physicians Congress of Delegates in Orlando. With me is Dr. Lori Heim, who is the chair of the board of the AAFP. And we just got out of this town hall session, very interactive, and I want to ask you a few questions about what transpired. My first question is about the RUC. There was a lot of discussion about the RUC. Can you bring family physicians up to date on this?
Well, the Academy for many, many years has talked about the fact that the RUC, which is about setting codes and how we get paid, that it's fundamentally flawed. That one is the whole method behind which they use undervalues what we do in primary care, and that it overpays procedures. So we have been working to try to get the RUC to change its composition and change its process. We have not been successful. We have taken now a very public stand with that and sent a letter with very, very specific requirements that we think they need to change in order to improve their process and structure. We also set a deadline for that. There have been chapter and member concerns that have come before the Congress that would say that the AAFP should pull out of the RUC. The concern has been if we pulled out, if we left, then our voice isn't there. And so it's always been, from an academy standpoint, our concern is about making sure that our members are paid fairly, because if we're not paid fairly, our doors close and we don't get enough students involved, and then our communities suffer and our patients suffer. So maintaining payment to keep family practices doors open and viable is very critical. But if you're not at the table, the thought was, how much worse can it be? The other part of that was, though, if we leave, by leaving, can we send a stronger message that points out how detrimental the current process is? And that's really been the question that the board has wrestled with over, just about the whole time I've been on the board.
Now, you talked about the problem with the RUC. Now, one of the potential solutions regarding payment is this task force that the AAFP has formed. Can you tell me quickly a little bit about that?
The AAFP has taken the leadership to convene a task force of a variety of policy experts, representatives from business, from patient groups, et cetera, as well as physician groups, to look at very specifically how do we change the methodology. And in the task force, two important things came out. One was that we all agreed that payment for primary care needed to change now. But secondly, we also know that we need to change not only payment, but that family medicine practices and primary care practices need to provide more services that are comprehensive. But with that comes a transformation of their practice. And with that has to come a transformation in how we pay for that over the long haul so that it is sustainable. Okay. So the task force is really dealing with both the immediate and sort of the long term.